Hello. In this video we're going to look at reference ranges and patient-specific test limits. Tests in Dawn are configured with upper and lower limits to designate what counts as in range. Now these limits may differ from the normal ranges on your lab system. Using the default limits from your lab system may result in too many test results being flagged for your attention, when really the reason for them being slightly out of range is very unlikely to be anything to do with the medication the patient is taking. As such, in Dawn you can set the limit slightly wider so that you're only being alerted to significant test results which do need your investigation. However, there may still be patients for whom the default limits in Dawn are inappropriate. This may be to do with a particular diagnosis or a particular medication that they're on that you would expect test results to be slightly different to the normal ranges in Dawn. And in that case, you can set up what's called a reference range, which allows you to override the default limits in Dawn for particular tests. So you can then use that reference range on a group of patients to ensure that their results are flagged at slightly different levels to everybody else's. Furthermore, there might be individuals whose full blood counts or liver function or UNEs are consistently different to the norm, and yet that is normal for them, not a sign of their medication, so you want to be alerted when their results are different to what the norm is for them. And in those cases, we can set up patient-specific test limits. In the video on dealing with abnormal results, we did see examples of these in action. We saw a female patient who was on a reference range for female patients where the hemoglobin was flagged at a lower level than it is for male patients. And we also saw an example too of another patient who had an even lower hemoglobin lower range limit because her hemoglobin was normally lower than most. What we'll look at now is how you set those up and how you apply them to a patient. So let's start by looking at reference ranges. You can find any reference ranges you have set up from the management menu, normal tables, reference range. And what I have here is one for female patients. By default, Dawn comes configured with test limit settings based on the British Society of Rheumatology guidelines, which are wide enough to encompass both male and female patients. However, let's imagine you were running initially anyway with your lab's normal ranges, and for certain tests the lab has different ranges for male and female. So perhaps you've put in by default what the male test ranges are, and you want to create a female reference range to override those settings for female patients. Well, here we have an example. I've put several tests in here already, but I've got one more to do. So let's see how I would do that. And I would start by adding a record. And it's telling me I actually have to unlock this form. So I will click on a test result, press edit, which warns me that I must be very careful about making changes here. Inadequate settings in these tables may lead to inappropriate care. So I can acknowledge the warning, press edit again, and that then makes this form editable. And I can click the new button to add a new test. The test I want, I can see it's at the top. If I was doing more than one test, I could select them both at the same time. And I click that, and that brings up the settings for this test. Now I can see that the existing upper limit here is 180 and the lower limit is 130. I'm putting in limits that are more appropriate to female patients. So I'm going to make the upper limit 165 and the lower limit 115. And save that, and that is now added to the other tests I have in this reference range, which have similar overrides. So we can see that the serum creatinine is using a range of 45 to 84 in place of 59 to 104. Some tests like AST and GGT only have an upper limit, but in this case we're using an upper limit of 35 instead of 50, and for GGT 36 instead of 61, and for CK we're using 25 to 200 in place of 40 to 320. So now I have my female reference range, but how do I apply that to the patient? Well, as with anything to do with the course of treatment the patient is on and their current monitoring profile, we do that within the treatment plan. So I open the treatment plan form, and here below the therapy template is the reference range, and I can select that now. I'm going to go back to the patient. Now, if I have a look on the Interventions tab, which lets me click on interventions and see a little bit more detail about them, this detail screen tells me which limits are in use. So I can see the default is 130 and 180 on the high side, but because this patient is on the female reference range, the limits for that are 115 and 165, and because the reference range overrides the default, these are the effective limits, 115 to 165. But it might be that this particular patient, when it comes to hemoglobin, they're regularly low. So in her case, a result of 110 is normal for her, and I don't want that flagging. I perhaps want test results flagging for this patient only if they drop below 105. In this case, it's not a reference range I need. I may still need the reference range for some of the other test results, but I need to create a patient-specific limit, something that only applies to this patient. And again, I do that by opening the treatment plan form, and on the right hand side I have a tab for test limits, and when I click on that I can see we've already set one up for albumin. So this patient already has patient specific limits for albumin, but I want to add additional limits for hemoglobin. And again I have to unlock the form, which means clicking edit and acknowledging the warning about being very careful with how I set these settings. Once I've acknowledged it, I can press edit again, and now I can press new. This is very similar to what we did with the reference range, but here we're not creating a range to use for a whole cohort of patients. We're just creating settings for this particular patient. So again, it shows me the default settings for the test. So it's 180 and 130 are our defaults here. We're not going to, I was about to put in the upper range for the female reference range there, but I actually don't need to. If I don't want to override anything, I can leave it blank. So really I only want to override the lower limit. So I'm going to put 105 in there and press save. And now, if we go back to the Interventions tab and click on hemoglobin again, we have another line in this table. And what I can see is that's the default, that's the female reference range lower limit, but this is the specific lower limit for the patient. And because that overrides the reference range, that is what is effective. On the upper side, we didn't define anything. And so what's effective here is the reference range, which of course overrides the default. So that is how you can use reference ranges and patient-specific limits to make the flagging mechanism in Dawn most appropriate for individual patients.